Today, we're going to hear real stories from real people about the impact that health care reform will have on their lives. For the American people, America's Affordable Health Choices Act will mean a cap on your cost, but no cap on your benefit. A cap on your cost, no cap on your benefit. That represents real change.
In some places in America, people think they have good health insurance. In some places of America, too many Americans have found out that they don't. We intend to change that. America's Affordable Health Choices Act means to make it possible for no one to have to worry that the health insurance they have will not be enough.
I heard those words, the three most terrifying words that you can hear in America: you have cancer. When you hear those words, it's like stepping out of the shower into outer space. You're disoriented. None of the normal rules apply of life, of the universe. Everything becomes surreal. This can't be happening, not to me, how? And when I finally found my tongue and the first things out of my mouth were, I know I can't afford this. Never mind that it was stage 4 uterine cancer and it had spread to the lymph nodes already. It was requiring an immediate radical hysterectomy, and that I was facing that I was no longer going to have the possibility of having children. The first words were, but I can't afford this. Never mind that there was a harrowing chemo cocktail and radiation cocktail that I was about to endure for the next 6 to 8 months of my life. That meant I would never be the same. I was consumed with the fear that I'll have to declare bankruptcy. Never mind that I was being told that the key to my recovery was to remain stress-free. Just stay stress-free. And all I could hear was, I'll probably lose my house. And so my health care nightmare began. What we're looking for, what we're asking for, what we're begging for, what I'm begging for is a current health reform package that becomes law so that people like me can receive adequate health care and aren't fiscally and physically ruined by getting a diagnosis of cancer.
Reform is so important as millions of Americans with insurance are being crushed by their medical bills, and through the health insurance exchange, small businesses, employers like Mr. LeCounte will have better options for covering their employees without the need for waiting periods or high deductibles. The current system is really unacceptable and unsustainable, and the time for health reform is now.
I now owe the hospital $28,000 and over $8,000 to doctors. I pay towards this debt each month, but I can't make a dent in it. We need protection from this kind of crushing debt, the kind of protection that the House Health Care Reform Bill offers. And we need to get rid of things like waiting periods so no one's left in a lurch like I was. We need portability of health care between jobs and more affordable options. Portability and affordability. We need to do it as soon as possible. Please.
Do you know that most Americans are not sure if their out-of-pocket costs would be limited if they were diagnosed with a disease like cancer? I've had that diagnosis of cancer. Unbelievable words. Unbelievable words. You are trying to come face to face with your own mortality, and not whether or not you're going to lose your house or you're going to be able to get the kind of coverage that you need in order to survive. That should not be what the lot is for people in this country who are trying to survive.
In 2006, I discovered a lump in my breast. I called my doctor to see what it would cost for me to see her, and she told me it would be $130 out of pocket. She checked me out and told me it was nothing to worry about. I didn't get a mammogram or any other tests. I can't help but believe that me not having health insurance affected that decision. Then Massachusetts started its new health insurance program that requires everyone to get health insurance. I was happy too, but on my waitress wages I couldn't afford it, so I was able to get Commonwealth care. I was still worrying about the lump that hadn't gone away, so I went to see another doctor who had ordered an ultrasound, a mammogram, a biopsy, and it ultimately ended up being invasive breast cancer. On July 24, 2007, I got a double mastectomy and reconstructive surgery. The bills totaled about $125,000. If I hadn't had insurance, I probably would not have made the doctor's appointment and gotten the test that turned up my cancer, and I might not be alive today to tell my story. Instead, tomorrow will be my 2-year anniversary of being cancer-free.